Hi, I'm Jay Miniotti. I'm a fellow of the Society of Actuaries and a member of the American Academy of Actuaries. I have an actuarial consulting company in Tampa, and this is part 2 of a presentation that we're doing on the Affordable Care Act, in which we discuss case studies that determine the costs of the law to an employer who would have 50 or more employees and be subject possibly to the penalties or employer shared responsibility under the law. In our scenarios, we set a baseline of 2014 when the law, for imaginary purposes, does not exist. It's as if the law did not exist and if we were trying to figure out what would our cost be as a starting point. But the law does exist, and we have really two main scenarios. One of which is, are we going to maintain our plan? What are the costs associated with that? And are we going to terminate our plan? And if we do so, what does the cost of those look like? Our approach is to bucket the enrollment in as many facets as it can be. Certainly you're going to have people enrolled in your plan if you choose to maintain it. They'll be full-time or part-timers working more than 30 hours a week and eligible for coverage. If they are not enrolled, it's because they're either waiving or they're not yet eligible under the law, or they would never become eligible because they work under 30 hours. Some folks are going to be covered by Medicaid, and others will choose to go to the exchange, whether you maintain a plan or you terminate a plan. We have two case studies. The first is a manufacturing firm, the second is a technology company. The first manufacturing company has 156 employees. All but one of them are full-time, and they offer 3 plans currently. And it was news to them to figure out that all of them had roughly the same actuarial value, which equated to a silver plan in the nomenclature of the healthcare reform law. The technology company has over 300 employees. A large proportion of them are part-timers, and they too offer 3 plan offerings, but it's more of a spread between platinum, gold, and silver. In the manufacturing company, we have collected in our first process the employee contributions and the full premiums, and as I mentioned, the actuarial values. These are inputs to the process of figuring out the cost. You'll want to run through the different scenarios and figure out where people are going to end up. And we have a calculator that runs the rules behind it to say if they are eligible for exchange coverage and you're maintaining your plan, but that coverage is more affordable to them, then they'll choose to leave your plan. We think that what folks want to know is how many people are on my plan, who's joining my plan, who's going to leave my plan, and what are all of the associated costs with that. Obviously, when you terminate your plan, there won't be anybody enrolled, but one of the assumptions that we'll make is that the people who currently buy from you will seek coverage in the exchange. If you were to terminate your plan, this is an estimate that we make that says, here's how those folks would be categorized. One person would be covered by Medicaid because they qualify, make less than 138% of the federal poverty limit. 55 people who waive coverage continue to do so. And then of the 100 people who buy from the exchange, 10 of them are better off because the premiums in the exchange are less than what they would have had to pay in a maintained employer plan. 90 people are going to be worse off, meaning they have to pay more in the exchange. And this is our financial summary. It's by scenario. The first line of this talks about the penalty that they might have to pay. If you terminate your plan, that's going to make a lot of people eligible for subsidies. And in the event of this case, it would have cost the employer $250,000. If they had maintained their plan, it would cost $300,000. So one of the simple choices might be, do I pay $311,000 on an expected basis to maintain my plan, or do I pay $250,000 and terminate the plan? That could be the end of the discussion for a lot of folks. The second piece of it that we are interested in knowing is this estimated higher cost that the employees might bear in the exchange. and it's for those 90 people who are worse off. They are worse off by our estimate to the tune of almost $500,000. So the employer has a choice. He can gross up their salaries if he likes to make those employees whole. If he were to take that cost into consideration, then his total cost is close to $800,000 versus the $300,000 that he would have otherwise spent to maintain the plan. Our second case is a technology company. We've collected similar information as we did to the first case. And the interesting thing here is that he's got 6 employees that are part-time. They work over 30 hours. They are eligible for the plan. And of those 6, 3 of them choose to join the plan in our scenario. The other 3 are covered by Medicaid. They make less than 138% of the poverty limit, and therefore wouldn't join the employer plan or an exchange plan because Medicaid would be considered free to them. In this particular case, we have a lot of folks who are Medicaid eligible. 10 people waived and continue to do so. 8 of them are going to be deemed ineligible. They work less than 30 hours. 55 people are better off in the exchange, i.e. they get a lower premium. And 189 folks are worse off. The financial summary says that if you were to terminate the plan, you would pay $472,000 in penalties. And if you were to maintain the plan, it would cost close to $1.9 million. This seems as if it would be a fairly straightforward financial decision, i.e. $1.9 million versus $500,000. We also are going to calculate the cost of that extra coverage that people have to pay for in the exchange. What is that extra amount that they have to pay? It's $600,000, and even when added to the penalty, you're still looking at a choice here of $1.9 million to $1.1 million. There's an $800,000 delta there. You might be surprised to know that this is a real case in which the technology company elected to maintain its coverage despite the anticipated cost because they wanted to retain their employees and they were going to communicate it to them as an extra benefit that they were providing in the eyes of healthcare. And they actually liked that idea of knowing the cost differential, that $900,000. They were able to use that to their advantage. This concludes the case studies. If you'd like more information about healthcare actuarial services or to have a tailored ACA cost calculation run for you, please contact us. www.jminiotti.com. My email is j@jminiotti.com. Our phone number is 813-442-4647. Thank you.